Hey everyone and welcome. Today we're diving into a drug with a seriously wild double life. I mean, on one hand, it's literally a poison, but on the other, it's a lifesaver for millions of people. We're talking about Warfarin, a blood thinner with one of the most incredible backstories in all of medicine. So let's get right into it.
So what do sick cows, rat poison, and a US president all have in common? I know, it sounds like the setup for a really strange joke, right? But the answer is Warfarin. And believe it or not, that one question tells you everything you need to know about the crazy, improbable journey of this drug. We're going to follow that trail from a farm all the way to the White House.
All right, so here's our roadmap for today. We're going to start with that wild origin story, then get into the nitty-gritty science of how it actually works. After that, we'll look at who really needs it, how doctors manage it to keep patients safe, and finally, what it's actually like to live with it day to day.
First up, the origin story. And I'm not kidding, you're not going to believe this one. It's a journey that starts out as a total farm mystery and somehow ends with treating the President of the United States.
Okay, so check this out. It all kicks off back in the 1920s. Farmers are baffled because their cattle are mysteriously bleeding to death, and it seems to be linked to spoiled sweet clover. It takes almost 20 years, but by 1941, scientists finally isolate the chemical culprit. But here's the real twist. In 1948, they create an even stronger version, name it Warfarin, and patent it as rat poison, and it worked really well. You'd think the story ends there, right? But nope. In this incredibly bold move in 1955, President Eisenhower has a heart attack, and his doctors treat him with that exact same compound. A rat poison literally saved the president, and just like that, Warfarin's place in medicine was sealed.
So, how on earth does something that started out killing cattle and then rats actually help people? Well, it all comes down to a really clever bit of biochemical sabotage happening inside your body. Okay, think of your liver as a busy factory that's constantly churning out these things called clotting factors. They're the little proteins that rush to the scene to stop you from bleeding when you get a cut. Now, to switch these factors on, the factory needs a key ingredient, vitamin K. Your body is super efficient, so it recycles that vitamin K over and over with a special enzyme. And that's where Warfarin steps in. It's like a saboteur that sneaks into the factory and blocks that one recycling enzyme. The whole vitamin K recycling line shuts down. So the liver runs out of usable vitamin K, and the clotting factors it produces are, well, they're duds. They're defective, and that slows the whole clotting process way down. And that specific enzyme that Warfarin targets, it has a name, VKOR. So when you hear Warfarin called a VKR inhibitor, that's what it means. It's not just randomly thinning the blood. It's going after this one specific part of the clotting process with incredible precision. It's a very targeted attack. Now here's something you really have to understand. Warfarin doesn't work instantly. Not even close. Why? Well, think about it. Even after you start taking it, all those perfectly good functional clotting factors that were already floating around in your bloodstream are still on the job. It takes a few days for them to get cleared out and for the new, not so effective ones to become the majority. Okay, so we've got the how down. Now let's talk about the why. Who are the people that actually need this powerful drug? Warfarin is a real game changer for several life-threatening conditions. For people with atrial fibrillation, or AFib, it's a huge deal because it helps prevent clots from forming in the heart that could travel to the brain and cause a stroke. For DVT and pulmonary embolism, it's used to treat dangerous clots in the legs and lungs and to stop new ones from forming. And it is absolutely essential for anyone with a mechanical heart valve because blood just naturally wants to form clots on foreign surfaces like that.
And that brings us to what is maybe the trickiest part of using Warfarin, the monitoring. It's not a set-it-and-forget-it kind of pill. It's more like a constant tightrope walk, a balancing act to keep you in a very specific, safe zone.
The tool for this balancing act is a simple blood test called the INR. All it does is measure how much longer it's taking your blood to clot compared to the average person. It's one little number, but it tells your doctor everything they need to know to get your dose just right. And for most people, this right here is the magic number. The target is to keep that INR somewhere between 2.0 and 3.0. That's the therapeutic sweet spot, where you're getting enough protection from clots, but without pushing the risk of bleeding too high.
It really is a fine line. You can see here, if your INR drops below 2.0, you're not protected enough, and the risk of a clot goes way up. But if it gets too high, say over 3.0, your blood is considered too thin, and now the risk of a dangerous bleed becomes the big worry.
The entire goal of therapy is just staying right there in that safe, therapeutic middle zone.
So what does all this mean when it comes to just living your life? This is where we get into the really practical side of things, the risks, the interactions, and the day-to-day management.
Let's just be really clear about this. The number one, most serious risk with warfarin is bleeding. Now, sometimes this is minor stuff, like you might bruise like a peach, but patients also have to be on the lookout for signs of major bleeding, things like a sudden, severe headache, coughing up blood, or dark, tarry stools. If that happens, you get help right away.
One of the biggest challenges with warfarin is that it does not play well with others. A whole bunch of common medications, from antibiotics to simple over-the-counter pain relievers like ibuprofen, can mess with it and send your INR soaring, which means your bleeding risk goes up too. This is why it is absolutely critical that every single one of your doctors and your pharmacist knows that you are on warfarin.
And then there's the diet question, which causes so much confusion. People hear warfarin blocks vitamin K, so they think, oh, I have to stop eating all my leafy greens. That is absolutely not the goal. The real key here is one word: consistency. If you normally have a big salad a couple times a week, that's fine. Just keep doing it. It's the big swings, like eating a whole bunch of kale one week and then none the next, that will send your INR on a roller coaster.
Now, in the last few years, a whole new class of drugs called DOACs have come on the scene. And they have some huge advantages, right? No routine blood tests, way fewer interactions. But warfarin still has its place. For one, it's super cheap. Its effects can also be reversed very easily. And most importantly, for some patients, especially those with mechanical heart valves, it is still the only proven go-to option.
Which kind of leaves us with this one big question. In an age where we have all these new, easier medications, how is it that this 70-year-old drug with such a strange past is still a cornerstone of medicine? And the answer is pretty simple. It works, it's affordable, and for some people, it's irreplaceable. It's a true medical marvel that just happened to start its life as rat poison.